All right, thank you for staying with Daybreak. Let's get into that conversation. We mentioned that we are flipping it over to you now. We'd like to hear your assessment of the various issues that are happening. First of all, we'd like to know your priorities for 2021. We'd like to hear your views on the education sector, how it has been handled by the government 9 months after schools were closed. More than 16 million learners expected in school on day 3. They should have reported by now. Government is recording 90% turnout. The media has been barred from schools, but I'd like to hear your experience on that. Healthcare, now nurses and clinical officers are threatening to down their tools again after the COG sort of reneged on a return to work formula, which they say it should be county specific. And even then, the current signed one, they say they don't have the budget for it, not in this financial year, not even in the next one. But the clinical officers are not taking that. We'd also like to hear your views about the BBI in just a bit on the push that's happening inside now. In fact, on the Daily Nation now, they're saying that there's a push and there's a battle over the BBI issue. That is what we're talking about. Let me introduce my guest real quick. Joining us online is Daisy Amdanyi, Executive Director, CRON. CRON stands for Community Advocacy and Awareness. Thank you so much for making time. Samuel Kimewe, Executive Director, AVF, which is the African Voices Foundation, rejoining us in just a bit. Irungu Houghton, Executive Director, Amnesty International, is also joining us online. Thank you so much for making time. And with me in studio is Mark Bichachi, Communication Strategist and also political commentator. Thank you so much for making time. Daisy, I'll start with you. What is your general assessment of the education sector, how the government has handled education in this pandemic? 9 months after schools were closed, they are reopened. Mostly, nothing much has happened.
Well, I would give them a fail in my assessment. And I think that it's very disappointing to see that they've had all this time, 9 months, to get ready, and when the schools open, people have been left to themselves. I'm not certain that the government is sure about what they are supposed to be doing with children other than sending them to these institutions. There seems to be no obligation on the part of the state to ensure that conditions for learning are optimum. Safety and security of the children is not guaranteed, and I find it a very curious thing that they would bar the press. Why would they bar the press unless there's something to hide? And the question then begs, so what have they been doing all these 9 months? We've seen across the world, one of the things that states have been doing is making ready for children to be able to continue with their learning. And this just speaks of the many failures that we've seen of this administration. Because when the COVID pandemic struck, there was the issue of how do we get children to continue learning within the midst of the pandemic. And you recall that there was the promise of the laptops. If that promise had been fulfilled, it would have been at least some kind of seamless transfer into ensuring that learning continued. But that didn't happen. We saw a promise of desks to be, additional desks and additional infrastructure. We have seen none of that happening. We have seen children in such terrible conditions. I mean, I saw a few days ago teachers trying to teach, 2 teachers in one classroom teaching different children, different subjects. And how are we not outraged? At what point are we as Kenyans going to say it is enough? Don't our children deserve dignity? Don't they deserve the right to safety and learning? How can our government be so irresponsible with the lives of children? Because aside from not facilitating learning, there's also the crisis of how children are going to get to school safely. The schools are not are withdrawing transport facilities. How are children going to get their meals? There are so many things that haven't been done. So the question is, what have they been doing for the last 9 months? Why hasn't Parliament summoned the Minister for Education, the Cabinet Secretary for Education, to demand answers? This is ridiculous.
Okay. Mark, what do you make of this first assessment, week 1?
Well, it doesn't take much to say that the government has indeed failed. There's really no defense in my view. And let's start here. Number one, the infrastructure improvements clearly don't exist, in as much as there's argument whether it's the MP's CDF or the Ministry of Education or the Ministry of Works. At the end of the day, the collective responsibility that is cabinet has failed in this particular juncture. Whereas we appreciate there was indeed pressure to open the schools, but there was also the common sense that there are many options that could have prevailed. For example, what they could have done is could have said that children, especially day scholars, go to school in shifts. So you've got half of the class in the morning and the other half in the afternoon. And that would have, for example, dealt with numbers. And if you say money is your problem, then shifts are not a problem, really, because you've got the same teachers and you're just changing how the kids go to school. But the fact that such common sense approaches have not been used, well, I cannot find myself in a position where I'm defending CS Magoha on this one. I think he's on his own. And let's not forget that his utterances, whether they were meant in jest or in seriousness, where he says that we could learn under trees, was taken in ill taste. And I know you can argue that there are schools in Finland where children are sent to the forest to study, but they go there to study the rocks and the trees and the birds and the bees. Here we are going literally to try and get a blackboard outside to get our children to study. So yes, there is something that needs to be done. The government needs to sit down and reconsider how it's doing this particular rollout. My first suggestion, because I like to have solutions instead of complaints, is number one, let the kids go to school in shifts. Number two, let us find a way of quickly developing the infrastructure. One solution could be suspending boarding facilities and transferring those boarding dorms into classrooms so that there's more space literally for our children. And this is not just a COVID-19 problem, it's a problem that we need to solve moving forward, because a lot of our schools were already congested thanks to the 100% transition program. But also I've seen here where they want to arrest parents who've not taken their children to school. Well, I would warn them, as a homeschooler myself, because my children are homeschooled, if you dare come and arrest me for homeschooling my children, you would be in a host of trouble. Because one of the things that this administration needs to embrace is alternative schooling methods. If we had a lot more alternative schooling methods, we would not have our schools congested as they are. So this requires a bit of innovation, it requires a bit of flexibility, and the truth is, I think Magoha dropped the ball on this one, to the embarrassment of the state.
But even though you say Magoha dropped the ball, in this country nobody seems to take responsibility.
Yeah, that's the sad part. The sad reality is we've seen him being removed of his powers of HR in the ministry. He didn't take a hint. We've seen Kenyans complain about it. He flip-flopped quite a bit when it came to when the opening dates would be, the instructions to the different schools on how they would open up. And so the mess we are in, my dear Magoha, you may have done well everywhere else, but in this particular docket you seem to be failing. I just can't find anything good to say. I'm sorry.
Okay. Irungu, what is your assessment of the first week of opening?
So first of all, Happy New Year, everybody. Despite the challenges we have, I think we have to continue to embrace a sense of hope and a sense of commitment to enforcing the constitutional obligations, essentially to provide the right to education and the right to health and various other obligations that are placed upon our state. I think the second point really for me is that if there were two words that described 2020, it has to be distress and defiance. And we know that inequalities and impunity provided the perfect ecosystem for the virus to attack us. Now, we may have a vaccine on our way, but there is not yet a vaccine for corruption. There's not yet a vaccine for incompetence, impunity, and inequalities. And I think that really is going to be the big challenge for 2021, if not for the next decade, for us, if we do not take decisive action. And I think this is the lens within which to look at the education system. We know that, as Daisy has said, that the impact of COVID was not experienced similarly by middle-class children and working-class children. And as we have seen with the rollout of public education and the opening of our public schools, neither the infrastructure nor the management of that has essentially been befitting of the expectations that Kenyans would have. And I think there are a number of good proposals that have been made already, the rotational proposals, the concerns around transportation, perhaps moving the boarding school. These are all good proposals. I think the key thing for me is also to note that internationally there has been a similar problem. UK went from a system where they have opened up the schools and they have had now to close them down. So I think we are in an unpredictable, uncertain phase still. And it doesn't help for the Ministry of Education to essentially make knee-jerk reactions and not be listening to various stakeholders that are out there. And I think every time the state moves without consultation, it's because of the complexity of the challenges that we have ahead of us and the inability of the state to be able to deal with the infrastructural questions. There's likely to be crisis. And I think the idea of parliamentary oversight, the idea of public oversight, are all good proposals that we have. And just for those people who might take comfort that by locking media or journalists out of our schools, that the information will not seep. This is not 1921. This is 2021. Every parent has access to a media platform of their own. They have access to Twitter. They have access to Facebook. So you will not protect schools from any mishaps. Essentially, what will happen is that people will stop listening to the Ministry of Education and start listening to other sources. So I think it's very important that this be done transparently and openly as well.
All right. Let's bring in Samuel Kimeu on this. Samuel, what is your assessment of this day, of the first week of schools reopening? What should have been done better?
Happy New Year, everyone. I think the first week of the year has been a bit chaotic, and I think it's not been completely unexpected, particularly if you consider that there are measures that were communicated earlier that were to be put in place, and it's quite evident that those measures have not been followed through. And there is a gap that you see between the COVID mitigation measures and the preparations, the guidelines, the gap between the guidelines and the reality in our schools. I think what needs to be done now, I think the Ministry of Education needs to recognize that it's important to engage with the stakeholders in the schools and to make the best out of a suboptimal situation. It's not time really for edicts and threats. I think it's time for sitting down and every school assessing its own situation, because the situations are completely different. There are schools that even before COVID had no infrastructure. There are some that had infrastructure that has now been destroyed. And there is also infrastructure that doesn't quite easily support the guidelines that have been put in place. So I think that consultation is important, and I think it's important that that is localized at the school level with, of course, the involvement of the Ministry of Education. But I do not think that there can be, a one catch-all action that can be taken now, considering that we live in different realities. Thank you, Trevor.
All right. Daisy, let me bring you back into this conversation, because you've given the government a fail on this. But we know that Rwanda's almost had about 20,000 to 22,000 about classrooms that have been built in that period where there was COVID-19. Here in Kenya, the CS says that we can't compare oranges and apples because Rwanda's general population is about 11 to 12 million. Our student population alone here is 16 million. Are you buying that argument?
No, I'm not buying that argument, because there are so many things that are available for the Ministry of Education to do. They could work in concert with the members of parliament, because remember, the members of parliament have awarded themselves what they're calling a national CDF fund. They could have worked together to ensure that in every constituency, the necessary measures, whatever expansions of schools, whatever infrastructure was needed, that those resources could have been made available through CDF and a joint effort be put in place to ensure whatever measures are put in place. Now, it's about planning, it's about leadership, it's about being able to understand that you have an obligation to deliver certain basic minimums of services to your citizens. These children deserve to ensure, the state needs to ensure that these students have schools that they can go to, where learning can take place, where safety is guaranteed. They've had 9 months to do that. But instead, what they have been doing is they have been channeling resources to anything but this. And for me, I wonder, because you talk about, I think the cabinet meets on a weekly basis. What do they discuss? Because this should have been at the top of their agenda, because they knew that this day was coming. It's not as though we did not know that children were going back to school. So, and we saw what other people were doing. Rwanda are our neighbors, and I think it's shameful that a country like Rwanda is making the news for all the right reasons, and a country like Kenya, that was once host to refugees from Uganda, is making the news for all the wrong reasons. So I do not buy the excuse. Let Magoha show us what measures they have made, a fraction of the kind of measures that have been made in Rwanda, so that we can say, okay, that they have tried. They haven't even tried. This is the thing, they haven't even tried. And I think that we should be outraged, because this is unfair. Just because people, citizens, cannot afford private learning and they are subject to public institutions does not mean that they do not deserve to have those services with dignity. Why should our children be subjected to this? Those children, these parents, even though they cannot afford to take their children to private schools, they desire for their children the same things that the parents who are taking their children to private schools do. They want a decent education. Yeah. The children need to be able to learn, and safety. Why is it so difficult for the government to provide this?
Yeah. Daisy, when you say Kenyans are not outraged enough, what would you have them do at this particular point?
At this point, we would demand answers. Parents should stop taking their children to school, and they should ask the government to come and have a meeting with the parents and tell them exactly how learning is going to take place, how their children are going to be kept safe, and all the measures that need to be put in place. Why would we continue to take our children into these conditions? I mean, I've seen in some parts of the country, children are walking past flooded rivers, crocodiles in the river, hippos. I mean, you're endangering your children in the name of what? Why can't we say, no, it is enough? Remember, Trevor, that we pay taxes. The government has just introduced new tax measures to increase taxes at every level, including businesses that are not making money. We pay taxes so that the government may provide us with services. Public education is one of the services that they have committed themselves to providing. Under Article 43, the right to an education, and a decent education, the right to safety. These are things that the state is supposed to provide for us. These are not abstract things. The state has an obligation to take those tax monies and provide us those services. Now, we are taxed to the limit, but we do not see the services being delivered. How is it that then we are not outraged? Even for those of us who may not have our children in these systems, we should be outraged, because it could have as well been our children.
All right. Mark, the other argument that the government is putting across is that this infrastructure has taken years to build. There's no way they would have turned it around in just 9 months, but there's some money that has been put through. We have 1.9 billion shillings for desks. We have 18.6 billion shillings now sent to schools, in as much as it's being sent now and not to previous months for capitation. Something is being done, right?
Yes, something is being done, and I'm sure the MPs watching at home would beg to differ, because there's a lot of the money that is given to CDF is actually supposed to go to classroom construction. The problem that we have is Kenya has a huge population of students, and it has a very high rate of people going to school, which is in itself is both a blessing and a curse. A blessing in the sense that in other countries like Tanzania, for example, if you come from a poor family, you just forget it, you don't try to go to school or not. But Kenya has done a big effort in trying to ensure that all our kids go to school. And that's kudos to our institutions and our country and the people themselves who've chosen that education is indeed a pathway to eradicating poverty. The problem that is here is that the government has not quantified what changes it has done and what improvements it has made. Now, unfortunately, is then because of that lack of information that then what we would see on TV and in the newspaper is a classroom where two teachers are sharing the same blackboard trying to teach two different classes in the same classroom. Now, that is a sad thing. It should not be allowed to continue. But what Magoha needs to do, and he needs to do this post-haste, is actually address the nation and actually say, how are these problems going to be solved? In Baringo, for example, where up to 15 schools have been submerged underwater, and this is why we are seeing higher student levels than was expected in these other schools because the children have transferred. What is he planning to do about it? What is the government doing? That's really what he's not answering. And for as long as the public does not have that answer, then Daisy would be excused in almost assuming that nothing is being done, because where there is no information. Like I famously say, when a tree falls in the forest and no one had it fall, did it really fall? And this is the thing that Magoha needs to address, and he needs to address it post-haste. There's also the issue of policy. And now, the policy around the constructions around schools, the cost of a classroom varies widely from one school to another. Who builds it? You know, recently we said that parents should not contribute towards the building of dormitories and classrooms. How then is the government through the Ministry of Works doing so? Is it solely a CDF issue? So there's much that needs to be addressed. It's not being addressed, and it's not going to be enough to go to a school and show kids wearing masks, because at the end of the day, we as parents know, because we have children, it is impossible to keep those masks. It is impossible to keep them from sharing sweets, but there is also a responsibility to show us that you're actually doing something, and that's what needs to happen. So give us a number, CS Magoha, how many classrooms have been built, for example?
All right. Irungu, let's now go to the solutions on this, because we are already where we are. I want us to talk about healthcare in just a bit, but in the education sector, now that we are here, what should the government prioritize and what should they do double time?
So I would perhaps differ with the idea of parents withdrawing their children from schools. I think the challenge there, of course, is that that pressure will not necessarily lead to improved conditions within schools. I mean, the children have been out of school, so this period, it hasn't generated necessarily the conditions to produce safe and dignified education, particularly within a COVID-19 response. But I think the key thing here really is how do we, I mean, there has been a history of social auditing that non-governmental organizations and various stakeholders have done in this country. And essentially what many of these audits have done is essentially to lay bare what is the conditions under which schools are operating. So I think the conversations around, you know, how many classrooms were built, how many masks have been distributed, how many desks have been purchased, and of course there was an attempt to stimulate cottage industry using these production of the desks. How much of that has actually happened? How many hand washing points are there for children? So I think the key thing would be for you know, students and their parents, if the teachers are not doing this, to actually do their own audits and make these public, particularly for the communities around them, and for education institutions that are independent to start now aggregating this up into some form of national sample, so that we do get a sense of what the scale of the problem is and don't have to rely on anecdotes or specific examples. And I think that's the first thing that I would probably suggest that needs to be happening in the course of this month so that we can get to grips with what the situation is and be able to confront the Ministry of Education. And in fact, even help the Ministry of Education to make a case for additional financing. And I think at this point, I don't have the understanding that either Magoha or any of his team at the at the ministry have an intention to lock children out of school or to keep them in unsafe and unsanitary conditions. I have just a sense that they don't have the resources. So they need that public pressure to be able to say that this, rather than the referendum, is where we need to be focusing if we are to allocate public expenditure at this point.
All right. Kimeo, how do we turn this around in the education sector? What should be the priorities now as we speak?
Yeah, Trevor, I think for me, we need to go back to the basics. I get a sense that the certain stakeholders within the education sector have been excluded from these conversations. I mean, the views of the parents and the caregivers, on what needs to be done and what kind of preparations ought to be put in place and whether in reality those preparations are in place. And I think it's not easy for the ministry to assure itself that this is happening across the country without the help of these stakeholders. I do think that the teachers and the ministry, as well as the student, work out ways of improving their situation in the school, in the learning institution, would be paramount at this point in time. Secondly, there is actually no doubt that there are resources are needed to actualize this. I mean, education is probably one of the single most budgetary undertaking for this country, and I think it calls for more resources. Unfortunately, of course, the governance missteps of the past and also currently make it difficult for the government to meet the obligations insofar as the right to education is concerned and meet it effectively. But that said, we must then go back to the drawing board and notice that education is such an important aspect in our nationhood that we have to invest more in it, and particularly in areas that have been marginalized. And I mean, when we speak, it's very easy to have this picture in mind of average, facilities, learning facilities, averagely staffed institutions. But there are places in this country that have been in dire strains, even when there was no COVID. And you can imagine what those places learners in those places are going through. I think it's important to have a broader picture of what we are dealing with and to try and deal with it. But for me, primarily, is to make sure that besides the resources, that this is a conversation that is 360, that every stakeholder that ought to be involved is actually involved. And it's not simply the ministry working with the teachers to the exclusion of all the others.
Okay. Daisy?
One of the things that I think that we must begin to demand of the government, we've just had a census that was done. And so the government should have a reasonable understanding of the challenges that are being faced, the number of children, because I've heard Mark speak about the rising population of students being both a curse and a blessing. The purpose of census is to enable the government to be able to plan better and to anticipate challenges. We have the meteorological department that gives weather forecasts. And so all these are supposed to aid the government in being able to plan. Now, COVID has been with us. It's almost a year since we've had the COVID situation. One of the first responses that the president did was to shut down the schools. Now, that should have been the beginning of planning with the census information, with the COVID information, with the meteorological department information. That should have been the basis for the state to begin to plan for the reopening of schools and the gradual return to school process. This has not been done. I agree with Kimeo that they should call a stakeholders meeting, but I still insist that I think one of the measures that needs to take place is that children should not be subjected to the kind of dangers that they are being exposed to.
Yeah.
And so perhaps learning, because we've also seen that there is a situation where learning in other countries has been stopped once again because a new strain of the virus has come out. So it is quite possible that learning would be stopped once again. But even as a stakeholders, an urgent stakeholders meeting is convened, I think that one of the things is that the children should not be subjected to these conditions, because we do not know what it is that we are subjecting our children to and exposing them to, perhaps even exposure to being infected.
Okay. I want us to talk about healthcare in just a bit before we move over to the issue around BBI push. Kelvin Mungai is saying, good morning. There are no COVID-19 priorities for the government of Kenya as far as Kenyan citizens are concerned. I've said it before that the government of Kenya has never cared and will not care. It is plain and simple. All these other things are shenanigans. That's Kelvin Mungai on Twitter. Engineer Lazaro Kanyambok says, barring the media from visiting our learning institutions brings a lot of speculations. What are they hiding? Government intentionally failed to improve infrastructure in schools during this long break. And you see here, Tony Kamau says, Kenyans have normalized everything. Parents should have refused to take their kids back to school. And Jenga Kungu Paul says, the issue here is that BBI has preoccupied the mind of the government. The time that the handshake got translated into BBI content is when all government priorities were suspended and nothing is in any importance until the referendum is over. All right? That's what you're saying generally on this issue on education. Let's talk about healthcare now. And Mark, I'll start with you. We see some kind of ping pong when it comes to this healthcare issue. Now there's a return to work formula. 11 days after the strike was called off, the governors are saying they were not really involved. They don't have the budget now. They don't have the budget in the next financial year, and therefore they cannot honor it as it currently is. The clinical officers and the doctors are saying, if you don't, we're striking again. Health is a devolved function. Who is fooling who here?
No, I like that question, and this is one of the things that I think we need, as a country, we need to get globalized views of a lot of issues. I'll give you an example. The flooding in Baringo is because Rift Valley lakes in general, from Lake Naivasha all the way to Lake Turkana, have been bursting their borders whether it rains or not. That is not a meteorological issue, it is a geographical, geospatial issue. And therefore, when you talk about it, it's easy to think, why didn't we plan for flooding? While it was not something we could predict. It's the same thing with this particular issue. I personally, whereas I agree that doctors need to work in the best conditions possible, I think a nationalized strike for doctors and nurses is not correct. And this is what I mean. Every county government has its employees in the shape and form of doctors. Now, there is no way you can strike nationally and the deal is brokered at the national level, and then expect the same to be equally and easily done at the county level, because different counties have different priorities. There are counties that think we've got too many doctors, it's costing us too much, and we really don't want to pay them anymore. There are counties that think that doctors are very important and they want to pay them more. This is why what the union of doctors and other health workers should do, they should localize their strikes. They should go to Kirinyaga if Kirinyaga is their problem, and that's where they should strike. They should go to Kakamega, and if Kakamega is their problem, that's where they should strike. And this is how it's going to work. Unless the doctors then say that they want health to be removed as a devolved function and they want it to again be a national function, then let them seek a constitutional amendment that reflects the same. And I've said this on many shows, and Kenyans have tweeted me thinking I am against doctors, but it is quite foolish to follow a path that does not give you the solution you desire. Look at the previous strikes during the Uhuru presidency and therefore during this particular constitutional dispensation. All of the strikes have been resolved at the Council of Governors meeting. Why? Because those are the direct employers. Unless you work at Kenyatta Hospital, work at Level 6 Hospital, you are really not a national government employee. And whereas it may seem politically expedient to win the imagination of the entire nation at the same time, it is legally and financially impossible to strike a deal at that level. Yeah. So let them go back to their governors, let them have conversations with their governors, not just about this particular COVID pandemic, let them also discuss about their staffing levels. Yeah. Because ever since this thing was devolved, governors are unwilling to hire doctors because doctors are the most expensive civil servants you can hire. And trust me, a governor wants to hire 300 people to mow the lawn instead of one doctor to take care of the people, of the patients, because it does not make political sense, in the sense that he's not creating enough jobs. Yeah. So this has to go back to governors, and I'm sorry, doctors, this is what you should have done in the first place.
Kimeu, you have actually had an actual research on this issue, and Kenyans talked to you about their priorities when it comes to healthcare. What were your findings?
Thank you, Trevor. I think, first of all, just to a rejoinder on the comment that Mark has made, is that I do think that there is no way we can say that because health is a devolved function, that we have to localize it at the county level. I do think that health is quite important, and I do want to see it still to remain devolved, but I want to see better management, and I want to see honesty on the side of all involved in dealing with the issues of healthcare. And I do think that looking back, I often think that we've paid lip service to health as one of the three issues that were guiding our nationhood at independence. And if you want to know this, I think you need to look at the resources that have been invested in that. But coming to the findings, I think we had set out, of course, with the support of UNDP, we set out to understand from Kenyans using very innovative ways. That's a combination of radio and SMS and social science data analysis. We sought to understand a number of aspects touching on healthcare provision during COVID-19. And I think the overarching theme that came through was that one, participants reported poor service and also improved service. I mean, those who reported poor service are mainly in the urban centers, where you would, of course, it's quite easy to see why that is the case. But there are also those who reported improved service, showing that in some counties in rural areas, the quality of service somewhat improved during that period, perhaps due to the exigencies of the moment. There was also the mention of poor service, particularly by women, which is, of course, begins to help us look at this from a gender perspective, perhaps because women are the primary caregivers in the family. They mentioned poor service more prominently than the men. There were also reports of inadequate access to drugs, and especially among the older populations, and also a view that health services have improved in some areas. And then there was also the question that we've been discussing that came up. There was a concern by quite a number of the participants that we needed to put in place mitigations for schools reopening. And then, of course, a livelihood question, that many lives were impacted negatively. And Trevor, as we speak about priorities for the year, as we talk about health and education, we need to also talk about livelihoods. How do we support those who have lost their means of livelihoods, those who have lost jobs, and are required to continue, discharging their responsibilities, either as parents and as caregivers. So we basically had heard from very different people, and I can give you some of the voices that came through. There were also questions around taking care of health workers. I do think that many of the participants, in a way, sympathized with the position of our healthcare workers, particularly around the provision of equipment and delayed payments. And I think during this period, we did see a number of cases where certain categories of health staff were not being paid in some of the counties. You know, people going for 2, 3, 4, 5 months without pay. And citizens really wanted to see this addressed. And people paid for their work and provided with the equipment to be able to discharge their responsibilities.
Yeah.
I think, Trevor, that pretty much summarizes our broad findings.
Yeah. Daisy, with all those issues that are now being raised by Kimeu based on what people are saying, what are we getting wrong when it comes to healthcare in this country? Because now there's another possible strike coming up.
I think what we are getting wrong is that we are not prioritizing it. We don't, as the state obviously doesn't see healthcare as a priority issue, because even when you look at the commitments that the government has made, it's regional and international commitments, including commitments, in the Constitution to be able to deliver this service, budgetary allocations, adequate budgetary allocations for it. It is not a priority. The issue of healthcare is not a new one. It didn't start with COVID. What COVID has done is that it has really exposed just how broken our healthcare system is. And this again calls for seriousness, on the part of the government in being able to understand that this is a service that is desperately needed by many. We know that many of the doctors during this COVID period have been exposed to several dangers, and we've lost quite a few. And I don't think we actually understand the implications of that, because the investment that is made, even in training of doctors, just losing one doctor, the implications. We already have a shortfall of the number of healthcare personnel in the country. So we can ill afford to lose them. And the only way that the doctors are able to negotiate with the government is by withdrawing their services and causing immense pain to many other Kenyans. But because the government has been consistently hard of hearing and listening to the doctors and coming up with solutions that will make their work easier, we continue to have this push and pull between the state and the doctors, which is unfortunate because the ordinary citizen gets caught up in the middle of it. I do agree that the discussions around how to address the challenge of healthcare should be a joint one, between the Council of Governors and the national government and the doctors. But we also know that the counties have been frustrated. Funds have been delayed. They've been delayed in release of funds. So the situation is very messy. I don't have an immediate solution, but I do think that it is time for us as Kenyans to demand that all the stakeholders within the healthcare sector actually sit down and come up with a roadmap of how to repair the healthcare situation in Kenya. Otherwise, these problems will continue even post-COVID, because they were there pre-COVID, they have been exacerbated by COVID, and they are not likely to change for as long as the attitude of the duty bearers remains as it is.
All right.